Hi, I'm Alan Weintraub, the Chief Procurement Officer for Enlo Medical Center. Today, I hope to answer some questions our community has had about Enlo Medical Center and our response to the COVID pandemic and our supply of PPE. For those that may not be familiar with the term PPE, PPE stands for Personal Protective Equipment. What it means to us in the hospital is that those are the masks, the gloves, the gowns, the face shields, all those type of items that help keep us safe as we are taking care of you. The question I get the most is, does Enlo have enough PPE? To answer that, yes, I believe we do, but it's not an easy question to answer. The COVID pandemic is unprecedented in its impact to hospitals around the world. Here at Enlo, we are tracking our usage daily, we are tracking our purchases daily, and we look at the relationship between our usage to our purchases, our burn rate versus our buy rate. And through this event, we've been able to secure what we believe right now is enough product to get through this event. Now, in the event of a surge or a larger surge than we expect, it may become more tenuous, but our tracking allows us within a day to alert everyone involved that there's been a change in our patterns here and gives us the opportunity to respond to that as an organization. The next question I hear frequently is, how has Enlo been able to obtain product and respond to this surge? And I would tell you, our core procurement and logistics team is a very experienced team with approximately 230 years of healthcare experience. This is the team that responded to the Orland bus crash. This is the team that responded to the Oroville Dam evacuations. And this is the team that responded to the Camp Fire. We are Enlo. We respond to disasters. And in this case, our team stepped up as well and obtained new lines of supply, built new relationships. We used our own disaster cache, which we had built through our experience in other disasters, and used that product to buy us some time. In addition, the generous outpouring of donations from our community allowed us additional time so that we can establish new relationships overseas and take our time testing products and evaluating sources of supply and avoiding some of the other difficulties that hospitals have had. You may have heard stories of hospitals paying all their money up front and getting no product, or one hospital in particular paid their money up front, received their shipment of masks, and the masks were made of newspaper. None of that was what we wanted to do as Enlo's procurement team. So we were able to take our time and make good decisions, good purchases, obtain quality product, use the community's donations wisely, and as an organization on the clinical side, we adopted each of the recommendations from the CDC and Department of Public Health to be mindful of how we use PPE and to conserve PPE and to be good stewards of the products we have here. Another question I've heard is about whether Enlo is out of the woods. Are you done buying PPE? To that, I would say, no, we're not out of the woods. We don't know how this pandemic will continue to unfold, whether a surge will hit the Butte County area or not, and how large that surge will be. So Enlo's procurement team continues to buy product from alternative sources and will continue as long as this goes on to ensure that our caregivers have enough product. I've tried today to provide answers to some of the most frequent questions that you have. Hopefully, I've answered more questions than I've raised. This is a complex situation, and the answers are complex themselves. To each of the community members, businesses that have reached out to Enlo and donated product, and to those who have made hand-sewn masks for us, on behalf of Enlo, I thank you. Your efforts allowed us the time to go out and procure quality product, medical grade product, and keep our caregivers safe. Your contributions have made a big difference. Thank you again, and we'll be here if you need us.